Professor Pankaj Chaudhary.
Professor Pankaj Chaudhary. Yes, sir, please come. And he is going to be telling us about the impingement of electronic gadgets overuse on myopia progression among young people. Please go ahead, sir.
It is more or less the same what previous speaker has told. So it was done again in the COVID period. So it is the electronic gadget overuse. I think all of us have used a lot in that period. So it was impossible to tell our kids not to use because that was the only way they were doing. So myopia is becoming a major epidemiological problem and its prevalence is growing worldwide. By the year 2050, 49.8% of the world population is expected to be suffering from the myopia and 9.8 from high myopia. The long period of close work like reading, writing and mobile phone use all cited as the possible influences. So purpose was to determine the effect of mobile and laptop overuse on the progression of myopia in young people at 3 time of points at the 6 months of intervals. A prospective observational study was done from January 19 to September 20 done over the 400 eyes of the 200 myopes categorized into the 3 groups based on the degree of myopia. A cycloplegic refraction and spherical equivalent was calculated in the time 1, 2 and 3. Progression was calculated as increase in the refraction between time 1 and 3. A task-specific diopter per hour was calculated based on the questionnaire survey. So that dioptric hour is calculated by number of the hours used and the distance and the type of the device used. So they were divided into low, moderate, high myopes, and depending on the number of the duration used, it is less than 2 hours, 2 to 4 hours, 5 to 6 hours and more than 6 hours, and progression was seen and odds ratio was calculated and the p-value was calculated according to that. So in the mobile use, the number used less than 2 hours was taken as a reference and the significant values were seen when it is more than 0.001. So association of progression when the distance of mobile used is also taken by taking a questionnaire that how they are using it, at how much distance they are using, because in the COVID period most of the time it is over the bed and all of us are, not only the younger people, all of us are also using the mobile very close to our eyes. The association of progression of myopia with the task-specific laptop diopters per hour was also calculated in a younger generation, those who were in preparing for NEET or doing their work from home. So the result shows mean age of patient with a low, moderate and high myopia was 18.62 plus minus 3.1 and 17.65 plus minus 3.5. Male to female ratio was 1.04. The task-specific diopter per hour were 20 plus minus 10 with the progression as compared to no progression in 10 plus minus 10. So to conclude, the myopia progression risk was significantly higher in eyes with a longer task-specific mobile and laptop diopter hours per day. Myopia onset on a younger age leads to the high myopia in adult life, and high myopia is associated with the increased risk of severe and irreversible loss of the vision. Thus, this study concludes that overuse of these electronic gadgets has a significant adverse impact on the myopia progression in the younger people. Educating and instructing the healthcare providers, children and their patients on reducing the screen time and taking a frequent break while using electronic gadgets will help to prevent the further myopic progression. Thank you. So its clinical implication is the same what we have already talked so many times, how to reduce it. We have not done axial length in this study, the reason being of the COVID protocol going on in that period, so not to be used that probe again and again. So it is only the spectacles and dioptric hour we have used.
That means you only use the progression in their
the dioptric powers.
In the refractive powers.
Yes, only.
As they came to you.
Because most of the things were done in that period by the non-touch techniques.
Right. So I agree. Where are you from, sir?
So I am from Riva Medical College, Madhya Pradesh.
Okay. Thank you. That was a nice presentation.